Welcome everyone to today's announcement. Excuse the froggy voice. I was with the kids all weekend at a baseball game. My name is Brad Stark and I'm the Executive Director of St. Leonard's Community Services. It is with great pleasure and excitement that we are gathered here today to announce a substantial step towards the completion of a project that has been in the works in this community since 2011. Speaking today will be the Honorable Dave Levac, Speaker and MPP for Brant, followed by the Honorable Dr. Eric Hoskins, Minister of Health and Long-Term Care. After Minister Hoskins, we'll hear from Donna Cripps, Chief Executive Officer of the Hamilton-Niagara-Haldeman-Brant Local Health Integration Network, and Jerry Johnson, a current client of St. Leonard's Community Services. Prior to a media Q&A session, we'll hear from Ann Coombe, Director of Clinical Services at St. Leonard's Community Services. Before I turn it over to Dave, I would like to thank him for his continued efforts to make this project a reality in our community. It was Dave that organized several community forums and consulted with local organizations to support the need for the services we are about to hear more of. So without further ado, I'd like to welcome to the podium the Honorable Dave Levac.
Thanks very much, Brad. This is indeed a very happy day for me, but more importantly, happy for the clients and to those individuals and families that need the services desperately from St. Leonard's and all of the other partners that are involved in this process. And one of the things that I learned very early on in the process in 2011 when I, on my own, by the way, it wasn't part of a platform from any party, I just identified something in our community that I know, and I want to give credit to all of the candidates in the 2011 election. They all jumped on board. Everybody decided that, yeah, this is something that our community needs and that it's time for us to kind of put our partisan hats down and get to work on working with all the partners. We had over 15 different partners going through the process from 2011 to now. And of those 15 partners, every single one of them supported the idea of a residential treatment center. And having said that, what really made me persevere was the fact that the government was just in the process of looking at mental health and looking at addiction. And then, unfortunately, the opioid issue started to kind of catch fire and understand the depth of importance it is to deal with addiction. Not just the opioid issue, but all addictions. And that culture started to change. And as the culture started to change to look at addiction of we're not at our best, it was very beneficial for us to kind of put the pieces together. I personally want to thank St. Leonard's for stepping up to be the lead on this process. The hospital was on side, the police were on side, firefighters were on side, all of the other services that were doing counseling were on side, and the families were on side, and the clients were on side. We even had people come to those community presentations for the first time to talk about their addiction and say this is something that we need. So collectively, this was a complete community process, a complete community response to the government about why we need this. And I want to thank the LIN for jumping on board as quickly as they did, because they too, in their research, identified it as an issue that needed to be dealt with. So that aside, that's my essay for the day. I want to thank everybody. And I wanted to also say that the media, all of the media in town jumped on it as well and did it as a positive story. Didn't point fingers, and no one was to blame. And that seems to be the wonderful cultural shift that's slowly taking place, because it still needs work. We still see columns of people saying, well, they took the drugs, so let them die. So that's the kind of mentality we've got to break down and make sure that families respond, clients respond, communities respond. And I'm proud of the community today to say, you were one of the first to jump on and say, this is time for us to move this bar. And that is going to make us a better community. It's going to diminish the pressure on the hospital. It's going to diminish the pressure on the police. It's going to diminish the pressure on the courts. It's going to bring and unify families again. It's not hard to understand. This easy answer is there, but when we finally got it, we're getting it. So congratulations and thank you, Minister Hoskins, for being here. And thank you for helping us during this journey. I want to congratulate the former CEO, and I want to thank Brad for his work to pick up the torch and carry that with all of the staff that are here. Obviously, this means a very large amount to me. I'm not an addict. There was an addict in my family a long time ago and got cured. And today carries with him his memory of how difficult it was to survive that without the kinds of helps that are now available. So I want to thank all of you for all the work that you do individually, families, and counselors. I want to thank all of you for understanding that this is the cultural change we needed to find the success that was there waiting for us to grab it. So now I want to introduce the Minister of Health and Long-Term Care. I introduce him as a friend. I introduce him as an acquaintance first, a friend, and then a minister, and you've got to show respect for that. I will say one thing very clearly right now. I am not announcing the money. The speakers can't do that. But there is some money to announce. So I just want to leave it at that. His education, he's a Rhodes Scholar from Oxford. He's a London Hygienic Topical Medicine. He's an Order of Canada recipient. He and his wife are humanitarians from around the world, saving lives all over the world. And I think that's good enough to simply say we have one of the best health ministers I've actually had an opportunity to meet. We have somebody who puts it on his sleeve and who genuinely believes in making people's health better. So, Eric Hoskins, Minister of Health and Long-Term Care.
You forgot to say that I'm Simcoe born and bred,
Oh, yeah.
which is
Almost in the writing.
yeah, yeah. And I have to be careful what I say because he is the speaker, and if I don't say what he likes, then I'm going to get the repercussions. I think in September once we're back at Queen's Park together. You know, I've been health minister for just over 3 years, and I was just reminding Dave that even and well before I was health minister, Dave began talking to me about this project and just how critically important it is for the community. And so you know this already, he has been an incredible advocate for St. Leonard's and for this specific project and program, as he has been on so many important issues and continues to be an advocate. But with this initiative, I think, as Dave himself has referenced, that it really is near and dear to his heart. It is with mine as well. And I think anyone who either has real life experience with substance use disorder, whether that is a prescription medication, an opioid, or alcohol dependence, anyone who has even the most peripheral experience themselves, a loved one, a family member, a neighbor, a colleague at work, understands just how critically important having that rapid, effective access to both withdrawal management as well as support to reduce and eliminate that dependency, how important it is in not just that individual's life, but all of those around them. Because, as we know, substance use disorder, addictions of whatever kind, have a tremendous negative impact on the individual, but also a tremendous negative impact on those who love them and are in their midst. So it's we've been working on finding a date for a little bit of a while where I really wanted to be here and make this announcement, and it would have been easy just to send out a press release, but I really wanted to come and be here because I feel so profoundly how important this investment is for the community. And as I'm beginning to understand from St. Leonard's as well, that it's a large community, whether that's in person or on the phone consultation and support, your helpline. That, what were you saying? You had somebody phone from California to your helpline, which is can't even begin to imagine how that happened. But the the service that's provided here is important. We need to remind ourselves, not simply for those who live in and around Brantford, but for the region itself and often beyond. So I want to, I think first and foremost, just to acknowledge and thank our hosts here at St. Leonard's Community Services for hosting us today, but most importantly, the work that you do every day. And thanks to Brad. Brad, you've been in this job. I know you've been here for a number of years. This current position of executive director for a few short months. But boy, I think as a result of today's announcement, you've got a lot of great work ahead of you. And I know that the team here in the community has 100% confidence in your leadership and in the leadership of Ann Coombe, who, as Director of Clinical Services, with her background, the community truly can have confidence with the team at the management and executive level, but the frontline workers and everybody in between that contributes to the fantastic work that St. Leonard's does. You can have equal confidence that this project, as it moves forward through to completion, will be successful and make an even greater impact with regards to the important work that St. Leonard's does. It goes without saying that the work that is done here and at your other locations make an immense difference in the lives of your clients and their families. So thank you again for that hard work and compassion. Dave and I don't get a lot of opportunities to do announcements together. I know he's sort of here as an observer. It's not his announcement being Speaker of the House, but it really does give me great pleasure to stand here today in his presence, knowing how much effort and passion and compassion that he's put into this project as well. So thank you for being such a strong voice for this community. And it's important to mention as well, like what Dave was saying earlier about this being a community effort and the collaboration across many, many agencies and the evolution that's taken place, the societal evolution, if I can call it that, how we are gradually reducing the stigma and understanding why what leads an individual to find themselves in a situation of addiction or mental illness, but specifically talking about addiction and substance use disorder here, that we have evolved as a society. We have a long way to go. And you need to know that what you found here in Brantford doesn't, and I know Donna can speak to this as well, it's not uniform across the province. There are many, many communities in this province where that work still needs to be done, where that societal change, the cultural change, the understanding of the validity of supports such as this, that understanding needs still to happen. So I commend and it's fantastic as well to see the local leadership and councillors here as well, with representatives from the police force as well, and that fantastic work that's being done with regards to diversion. But it really does take that strong partnership and that collective understanding of why and how this can be done. And it sort of brings me to, where's Jerry as well, Jerry Johnson? Jerry, thank you. I think if I've thanked a few people, I want to thank you the most, and I know we're going to be hearing from you in a few minutes, and because Jerry Johnson is not only joining us, but his experience is so important for us to not only understand, but to reinforce why this investment is so important. And so thank you. Congratulations. I know that you are successfully maintaining sobriety, but congratulations and thank you for your courage in sharing your story today and being here with us. And I know, and I'm anticipating, I know that you're going to credit St. Leonard's for being that foundational support for what has enabled you to deal with a challenge that most of us can't even begin to imagine. So thank you. And then Don, I'm going through a lot of thank yous, but this is important, and I think Dave sort of reinforced that by saying this is a community that is responsible. And Donna Cripps, who's the CEO of the Hamilton, Niagara, Haldimand, Brant, Lynn. I think it's not biggest in geography, but certainly more It's certainly, but in population, is it?
No, it's longest name.
Longest name of any of our LHINs. Now you've given me a, yeah. And Donna, you need to know, she is such an exceptional leader within our LHIN system. And again, not just for her geographic responsibility, but across the 14 LHINs that we have. And so I'm really grateful for that contribution. And I know that this is a project that she is extremely committed to and passionate about as well. So, you know, speaking of passion, one of the things that I am most passionate about as health minister is what's known or often described as health equity. And that's about, it speaks to access and equitable or equal access to our healthcare system. And I believe strongly that every person in Ontario should have and needs to have the same access to the same high quality care, no matter who they are, no matter where they come from, or no matter what their health challenge might be. But unfortunately, we know that there are many social determinants of health that continue to have an impact on an individual's health and their well-being, as well as their access to the healthcare system. You know, and when I talk about social determinants of health, I'm talking about things like housing and employment. I mean, issues that St. Leonard's, again, know very much about. So that's one of the reasons, in fact, why I am proud to call St. Leonard's a leader in Ontario's healthcare system. Your teams focus on delivering positive change here in your community and addressing those social determinants of health. It brings us kind of one step closer to realizing true health equity. So thank you for that. But today I'm here to talk specifically about the work that your team is doing in the area of mental health. You know, 30%, it's estimated, well, it's known that 30% of people in Ontario will experience mental illness at some point in their lifetime. 30%, that's almost 1 in 3. In fact, 70% of mental illness actually emerges for the first time during childhood or early youth. So by the early 20s, 70% of mental illness. And the statistic that I wasn't even aware of until earlier this year, which is really quite breathtaking, is that mental illness results in more years lost to death than all forms of cancer combined. Mental illness. So it is an incredible burden just in terms of lost life years or lost years of life. But imagine you add to that the quality of life issue and the impact that it has on individuals that have a mental illness and those around them. So I've said it many times before, there can be no health without mental health. Mental health and physical health, they're like two sides of the same coin, right? That you need both, and both are equally as important. And our society and our government and our programs and our ministry need to look at those two sides of the coin, mental health and physical health, and act with equal vigor and intent and commitment. And again, just like with the stigma of mental illness, we still have a long way to go, I think, in realizing just how fundamentally important mental health is to one's overall health and well-being, and ensure that our resources reflect that. It was mentioned earlier by Dave about Canada's and Ontario's opioid crisis, and it is, you know, I think it's a particularly hard-hitting and heartbreaking example of the devastating impact that mental illness and addictions can have on individuals. And I know Brant is no exception. In fact, there's no community in Ontario that's an exception when it comes to, regrettably, the opioid crisis that we're seeing. So our government has been working to address this issue of the opioid crisis through a comprehensive action plan that involves expanding access to local harm reduction services. So we have a needle exchange program here at St. Leonard's. In Toronto, where I came from this morning, They are in the process of opening up 3 safe injection service sites, and also with things like the distribution of naloxone. My goal is so naloxone is a medication that is a lifesaver. It temporarily, not permanently, but it temporarily reverses the effects of opioids. And so at that critical moment, when you find an individual who has overdosed, the availability of naloxone is quite simply a lifesaver. It can make the difference between life and death. And so my sort of goal is to, as close as possible as we can arrive at this, is to flood the province with naloxone. The more people, the more facilities, the more organizations that have easy and quick access to naloxone, that's only one part of the equation when it comes to the opioid crisis. But I'm very proud to know that that St. Leonard's again is, so that one additional service that they've recently added is the presence of and distribution of naloxone kits and the training that goes along with that as well. It's so important that can and will and has and does save lives. Don't worry, I'm getting to your bit in a moment. I haven't forgotten. So, in fact, we're making important progress. We're not yet, and I'm hoping we can avoid seeing the kind of situation that British Columbia and Alberta are seeing with the rapid escalation in overdose deaths, and the data that we're seeing bears that out. But that's why these programs and these efforts are so important. And a critical factor in addressing this issue, as well as other forms of addiction and dependencies, is improving access to high-quality community addiction treatment. As all of you know, I think, for some time now, St. Leonard's has been operating a successful day treatment program, but only on an interim basis. I'm not even going to begin to imagine what that means. It probably means that we're probably funding you like 1 year at a time or something like that, or I don't know. So these are services, that day treatment program is so critically important and valuable to this community. But that interim label is constantly hanging over the important work that's being done here, but not anymore. And I know Donna has been a big part of this as well in terms of releasing funds. So it gives me great pleasure to announce that our government is investing, this is the tricky part, millions of dollars, and I'll explain that in a second, to expand the addiction treatment program at St. Leonard's Community Services. And the reason why I'm saying millions of dollars, and I'm not giving a specific number, is because I know we're close to, there'll be a bidding process, right, where for the capital part of the expansion here, and we don't want to influence or taint. I mean, it'd be ludicrous for us to go out there and say, well, here's what we're prepared to spend, and then the bidders are going to sort of have big smiles on their face, right? So we want to be a little bit secretive in terms of the exact moment, but certainly we're talking about, with the increase in operating investment and the capital investment in the order of millions of dollars that will be invested in St. Leonard's to expand their addiction treatment program. And so the investment will bring 2 big changes, and probably more. I mean, the first is obvious, that the program that you're providing will no longer be interim. It's been proven successful and is so valued and important. The second change will be, and hopefully somebody's going to talk a little bit more detail about this, because I can't believe this has been going on since 2011. I don't know, you're probably on like the 4th iteration of the design. So, but the second change will be the construction of a new residential withdrawal management and addiction treatment program right here at St. Leonard's. Finally, right?
We got you recorded.
And my job is done. The expanded services will very soon include, obviously the day program will continue. but also residential programs for substance use withdrawal management, which is important, obviously, and addiction treatment, as well as, importantly, aftercare supports for both clients and their families. And it will include 14, I was going to say new beds. I mean, that's, how many beds do you have now?
That facility gone because it's just day treatment.
Yeah, so going from zero, so not new beds, you're 14, the first 14 beds. So it will include 14 beds for withdrawal management and addiction treatment. That's pretty tremendous, and I think it's a testament to the hard work, let alone the impact that St. Leonard's and your partners are having. So, and I, want to and should specify that these services will obviously go beyond opioid use disorder treatment and will provide care to people with a wide variety of substance use disorders. So today's investment is an important part of our government's work towards improving access to mental health services for people living with illnesses ranging from depression to substance use disorder. But it's because of our incredible and dedicated partners, like the dedicated professionals here at St. Leonard's, that we have an opportunity to create a healthcare system that values mental health as just as important as physical health. We've got a lot of work to do, but today's announcement is going to have obviously an enormous impact on the lives of people here and beyond the community living with substance use disorder. So thank you to everyone here today, and even those not here today, for making this announcement possible. Thank you.
Thank you very much, Mr. Hoskins. You're right that we now have a lot of work to do, but you're also right, we have a team that's going to be up to that challenge moving forward. Next, I'd like to invite Donna Cripps, CEO, and this is a much easier way of saying it, the HNHB Lynn, that rolls right off the tongue, to deliver her remarks.
Thank you, Brad. Good afternoon. Firstly, I'd like to thank our Minister, Minister Hoskins, for this very welcome announcement today. It is something, as our Speaker, Honourable Levesque, has said, we've waited a long time for this. So thank you. Thank you for it. Thank you for caring about our Lynn. Thank you for caring about the people of Brantford. Thank you for caring about the people of Ontario, because that's what it's all about. I'd like to also express our gratitude from the Lynn to our partners at St. Leonard's Community Services for hosting us today, and for members of the media who are here to learn about this important investment, which will make an incredible impact on the lives of people who are struggling with addiction. I'd like to also acknowledge the Honourable Levesque. Mr. Levesque, you have been absolutely tireless in the conversations that we've had about mental health and the impact of mental health and addiction issues within your community. And that has certainly made us at the Lynn more committed to acknowledging and moving forward in the right way. So thank you for your leadership on that. I'd be remiss if I didn't mention that the mayor of our community here and the city council is also very committed to having a very healthy Brantford. And I'd like to thank them for their leadership today as well, because without your leadership, we couldn't move forward with this. Addiction, as has been mentioned, is a growing concern in Brant, across our Lynn, throughout our province, and indeed across our country. As a result, there is a growing need for addiction treatment programs like those offered at St. Leonard's. I think it was about 3, maybe 4 years ago that the HNHB Lynn board acknowledged that in fact there was no residential addiction treatment program in Brantford, and that we needed to be able to rectify that. We needed to be able to offer the operating funding. While we don't do the capital funding, we needed to be able to release the operating funding to be able to make something like this come alive. So today's funding announcement will allow for the construction of this new facility and renovations to the building in an effort to provide more people with access to the necessary care and support to help them recover from their addictions. Without a doubt, this investment is going to change and even save lives. One of our highest priorities, our top priority, is to ensure safe and timely access to healthcare services, including addiction treatment programs. Today's announcement will help to make sure those services are available to those who need it most. Again, Minister, we thank you for this investment. We thank St. Leonard's for the incredible work that you, Brad, and your staff, and Anne and your staff, you do. We look forward to continuing to work with you, but also all of the health service providers within the Brant region. We know that to make this all happen, we need the community, we need the city, we need the social services, we need housing, we need the addiction programs, we need the physical health services, we need the hospital to be all working together to make it all to come together. Thank you so much for this.
Thank you very much, Donna. As mentioned before, St. Leonard's is currently delivering addictions day treatment program that we have been dubbed not interim, but phase 1. Our next speaker is a graduate of that program and is currently involved in aftercare programming with St. Leonard's. Jerry will be speaking to the value of a residential program in the Brantford community. So I'd like to welcome Jerry Johnson.
Well, thank you all very much for inviting me here to say a few words today. What a room full of Canadians. How many times have we said thank you and I went straight to it myself, right? Okay. Well, thank you. Oh, I did it again. I'm going to start by saying I'm a very emotional man. Uh-oh. This is a very happy day for me to be here. I've struggled with substance abuse issues for a lot of years. And last October, I had relapsed. I had come to the end of what I'm very happy to call my last relapse. And I realized that I needed to do something different than what I had done before. I had quit lots of times for varying lengths, sometimes a couple of years even, but always got back to doing it again. Somehow convinced myself I had gained some control. So anyway, last October, I found a 800 number that directed me to services in the community. I lived in Burlington at the time. The Burlington facility answered my call on October the 3rd by saying, "We can see you, Jerry, for an intake interview on December the 6th. While I was still on the phone, I said thank you and took the appointment. I muttered a couple words after I got off the phone. So I called the second number they gave me, which was the Port Credit Hospital. I left my information on their voicemail, and then I called the third number, which was St. Leonard's. And the woman that I spoke to at St. Leonard's asked me a few questions and asked me if I wanted to wait to hear back from the hospital, and I said, no, I like your answer so far, and if I'm recalling correctly, which is maybe shaky, this was on a Tuesday, she asked me if I could come out and see her on Thursday of that week to complete the intake process. Well, I'll use an expression that I picked up on one of my trips to Texas. I said, hell yeah. So I got out there right quick and met with Lacey, that was, and we went through the rest of the intake procedure, and she asked me, could I start the program the following week? She got a second hell yeah, only that one was in person. So I very gratefully started the St. Leonard's Day program. What would that have been? Maybe second week of October last. So I'm very happy to be standing here telling you people today that I'm past 10 months of being clean and free. Yeah, thank you, thank you. Thank you. Yes, I like the applause. Stop. All right, just a little more. So I was saying to Mary before this presentation started that it's no surprise, but it sure is nice to say my life is so much better. You're not surprised to hear those words, but you're happy to hear it too. Not quite as happy as I am to be standing here saying it. I'm very happy to have heard you, sir, say that there's going to be a residential program now offered. I mean, there's no way for me to know what difference that would have made to my life. there were certainly men in the program. Part of the rules of conduct were don't show up high and don't come in hungover. So if any of us had been out doing what we had been doing the night before, take a day off, right? And I certainly could appreciate that. So there were days during my 6 weeks that some of the men weren't there. Pretty clear why they weren't. So if there had been residential services available to those gentlemen, now I can't say for sure, you know, depends how desperate we are to do what it is we want to do, but it would have been a lot more difficult for them to get the substance that they wanted to get if they were in a residential setting. So I'm very happy to hear that. I'm very, very grateful that I found my way to Brantford. And I mean, it's only a half an hour drive from Burlington. It's not like it's all that far. One of the men that was in the program when I came from London. And I'm very, very grateful that I found St. Leonard's, that I went every day and I paid attention, and I was a enthusiastic and willing participant in the activities. And I mean, I caught on quickly to that. Shane, that was the one-on counselor, pretty well said to me, the harder you work, Jerry, the more you're going to get out of this. I thought, well, that's what I'm here for, is to get all that I can out of it. So I'm pretty sure on the first or second day, I stood up in the room and got as choked up as I've been right now. And I said to the other men, I'm here to help Jerry. And you're here to help Jerry too. And we're going to help Jerry by being active, willing participants in this function that we're here for. So I expect all of you to speak up and say what's on your mind and do everything you can to help me. And if that helps you too, that's good, but let's make it clear we're here to help Jerry, okay? And it worked, you know, and it continues to work. And I go to the aftercare sessions on Mondays at St. Leonard's, and I do my best to share that with the men, some of the guys that I knew from the treatment, some of that I've only met since. And the more we all work together to help me, the more it helps all of us. Thank you all very much for giving me this opportunity to say thank you. Thank you.
I'm really shy, but this kind of thing helps.
You're shy, but Jerry is not. Yeah. And last but not least, I would like to welcome up Ann Coombe, our Director of Clinical Services.
Oh, wow. Gosh. This truly is such an amazing day of celebration for our community and our many clients that we support, like Jerry and the many other hundreds. But we know each and every one of them intimately, just like we know Jerry. Many, many people, far before my time, have put hundreds and hundreds of hours into this dream to become the reality that it is today. As we've talked about, this is a community that is known for its many collaborations with a variety of community partners across all sectors, including justice, health, mental health, education, and we all work very closely together to support our most vulnerable populations. That's what we're here to do. We've been so appreciative of their patience with our community partners while we've worked together with the Ministry of Health and the LHIN to get us to where we are today. It's clear that addictions and mental health is a priority for Minister Hoskins and his team, and we're so appreciative. St. Leonard's was recently approved to be able to provide nasal naloxone, which Mr. Hoskins briefly spoke about as well, to our clients who are using opioids and at risk of overdose. And the swiftness of action that led to me standing here today before you with this kit in my hand is, in my opinion, unprecedented. As I told Minister Hoskins, we ordered it, and 3 days later, we had our kits. We were shocked. Over these past few months, we've been greatly encouraged by the work of our ministry and the LIN to better understand how our community can work even better together through a harm reduction approach to deliver services to people when they need it most, like Jerry spoke of. We are definitely all working harder than we ever have before. We laugh about that around here. However, we must challenge ourselves to consistently deliver high-quality services. And to do this, we must ensure that we have accurate data and patient evaluations to support the work that we do, and make changes and improvements as we need to along the way. This is very important. We do see time and time again that stigma can often get in the way, and I believe that every one of us has a responsibility to educate those around us and help us to better understand that those of our friends, family, colleagues, and the like who may benefit from substance use services and a withdrawal management center, they really are any one of us, and I say that often. And there's no shame in knowing this and encouraging people to seek help when they need it. We are encouraged and appreciative of our government's approach in this regard, and look forward to a day in the near future where those with substance use issues will no longer have to feel like they do not belong. So thank you sincerely, Minister Hoskins, for your support in making our dream a reality today. And in closing, and one of those amazing community partnerships that I talk about all the time, here in our community, and I was telling Donna a bit about it, we've had an opportunity to pull together a fentanyl, what we call our fentanyl roundtable, which is ourselves, Brantford Police Services, the Brant County Health Unit, and the city, amongst other partners. And we have pulled together a website called Fentanyl Can Kill. So as a token of our appreciation, Minister Hoskins, I thought you might appreciate this.
He's not a rookie anymore.
Oh,
He's not a rookie anymore.
Yeah, I might have done that in the first year.
so thank you very much, everybody.
I will wear it, though. That's great, sure.
And that concludes today's gathering. We're going to have a media Q&A session over to the side, but thank you everyone for coming. I'd like to recognize two board members we also have here in attendance today, Eileen McKenzie and Ron Hannon, who have joined us. Thank you very much. Yes, and we'd like to gather for a photo as well. Thank you very much, everyone.